Provinces are preparing to play their part in rolling out the COVID-19 vaccines. On Tuesday, we heard a comprehensive plan from the KwaZulu Natal Premier. The Eastern Cape legislature on Wednesday, the Health MEC Sindiswa Gomba confirming the province would receive its part of the AstraZeneca vaccine on the 9th of February. That's next Tuesday. Let's get more detail on the Eastern Cape rollout plan now. And I'm joined by Dr. Tubile Mbengashe, advisor to Eastern Cape Premier Oscar Maboyane. Good evening, Doctor. Thank you very much for joining us. So we've got some details on the Eastern Cape, and I just want to clarify, you've got 571 people identified to actually do the vaccinations, and each of them you're hoping will do about 50 vaccinations a day. So that means that you will be ready, hopefully, to administer over 28,000 jabs a day. When is that likely to start?
I think what we are hoping for is that the 9th of the deliveries to the provinces will take place. In terms of our preparation, we have done quite an extensive amount of work where we've actually got all the staff in our hospitals, in public hospitals, and we also work with the private hospitals to actually determine the number of people that we need to vaccinate. I think quite honestly by now we think about the number will be just about 100 to 120, and that's the first dose. And the big work that has been done was really to make sure that the vaccine has security and its safety and efficacy, and we spend a lot of effort in trying to make sure that we've got a good cold chain to make sure that these vaccines work when they're actually used.
So, and please correct my maths if I get this wrong. If you are going to be doing 28,000 odd vaccinations a day and you're hoping to get to about 120,000 staff, that's not going to take you much longer than a week or so, is it?
No, I think the key issue here is really part of the very hard safety measures that we need to do. I think what we are really, of course, what we are really trying to do is that the 15 minutes time of wait and making sure that those people that are waiting after the vaccine have really all the support and clinical support that they can get. Ordinarily, if you really streamline the services, you should be able to do more, but I think we think that it's going to require us to be very careful in the beginning. The second decision why we are moving very slowly, we have decided not to pre-fill our vaccine injections, and that will be done at the time of actually doing the injections by the vaccinator who's a qualified person to do so. And that is holding us back. But I think there will be some review about how fast we can move, how much safety we can get, what levels of concerns that the staff have in terms of patient safety.
Will you be getting enough doses in the Eastern Cape to give every healthcare worker 2 jabs, or you're just trying to get as many as possible to get 1 jab for now?
This is a big discussion that is ongoing now, and I think we're kind of feeling that, look, there is a need for us to expand the number of jabs that everybody gets, but we'll always make sure that everybody gets a second jab. And what is going to be important is really the amount of vaccines that we have in terms of the time that we'll get and the projection that we can get. We know that National is working very hard to try and improve on that. And the other part, of course, is really the time it takes between one vaccine to another. I think there's good period between the vaccine in terms of the ones that we're looking for. And I think up to 3 months we can actually push this. So our priority is to get as many people as possible, make a commitment to have the second dose, but we don't want to hoard vaccine in order to give the second dose.
Do you know exactly how many doses are coming the Eastern Cape's way next Tuesday?
Yes, we know it's about 60,500 doses that will be coming on our way next week.
All right, so that could give everyone 1 dose. That makes a lot of sense. Yes. You spoke a little earlier about the cold storage issue and the cold chain. So these vaccines have to be transported in refrigerated trucks when they get to the site where they're going to be administered. And this probably isn't going to be as much of a problem because of the hospitals that have backup generators, that have refrigeration units. How concerned are you about the cold chain transportation of vaccines, particularly to your far-flung rural areas?
I think you're quite right. I mean, one of the biggest challenges we have, especially when we get the 20 million doses, which are much more demanding in terms of cold chain. But I think the technologies that are being brought, like the ice, to try and keep these vaccines at a very low temperature, that is going to assist quite a lot. We're looking very closely to make sure that we are building up the capacities of our hospitals to manage the ultra-cold vaccine requirements. But what is also very important is really the just-in-time transportation and logistics system that we want to invest on, and really the continuous monitoring of the vaccine in transit, because there are a little bit of leeways if you really manage that part and you don't keep your vaccines after the deep freeze component, you don't keep them in excess of that time, and you make sure that you deliver the quantities that you require, and so that most of the vaccines are not on the way or in the facilities where they can actually be damaged.
Who is going to help you? I know that this has been centrally controlled, now it's going to the provinces, but the President and the Deputy President have both said that this is an all-hands-on-deck situation, that you need the private sector to assist and your NGOs. Now, I spoke a little earlier to an NGO that said they have not actually been asked for assistance, but they have got refrigerated trucks available. So who's going to help you as a government to get this out?
Yeah. This is very important, because what we're working on is that we've got the 2 depots with a very we've assessed the quality and the quantity and the management of temperatures in those depots, and most of those have just been recently refabricated, and therefore they are going to be our major sources of storage. Our big 8 hospitals have got a huge capacities to keep doses in the lower levels, and we have a number of suppliers that we've been using in terms of the transportation of medicines. You'll recall that we have been vaccinating people. That includes the young people, children, and also we've been providing the HPV vaccines to the young girls at school. And therefore, we've got the capacities of actually really managing the vaccine situation. But obviously, our roads are going to be very important. In terms of the distance, that's going to be very important. So in the first phase, because most of the first phase will be happening in really well-developed sites that are hospitals and the clinics, that's going to be much easier. So our preparation now is to do a lot of work to make sure that by the time we get to the phase 2 and phase 3, we have actually developed a lot of capacity.
You know, it sounds like a good plan, I have to say. How confident are you? Can you give a guarantee to the people of the Eastern Cape that your plan is going to work, that you're receiving your first doses on the 9th? When did you say you're going to start rolling out?
On the 10th. On the 10th, they should be in people's arms.
All right.
That's the level of readiness. I think what we're really saying to the people of the Eastern Cape, we're very tightly looking at the science of our vaccines. We understand what the requirements for keeping them safe, effective, and of good qualities. We're investing quite a lot into that. And the second one is that really the key issue is the ethics of really making sure nobody jumps the queue, gets the levels in there. And the last one is really building up the resources for implementation, getting sufficient people, making a lot of support. We are actually talking to business sectors. We are talking to private sectors. We're talking to private hospitals. We're talking to businesses. And we're really building onto that. And I think we've got sufficient time to be confident that by the time really the vaccines for phase 2 arrives, we're ready. Because the other phase 1 is fairly well catered for, because most of these people are used to injecting people on a daily basis.
So it's
just to understand what to do with this.
It's a good test case. I have to ask you, can you guarantee corruption is not going to get in the way of this rollout?
This is where a lot of experience in the PPE. We are very confident corruption is not getting into this. One of the decisions we're taking is that we're not going to outsource the services. We're using the current suppliers, which we brought earlier on, to make sure that we're delivering our services in the rural areas. It's really going to be a security issues. We're going to be looking at these vaccines, following them up. We're looking at technologies of how to tag them so that we know exactly. We're going to give a lot of audit about what vaccines are used so that we're able to account.
Well, good luck to you, and thank you very much for giving us so much information. Dr. Thobela Mbengashi, advisor to Eastern Cape Premier Oscar Maboyane. Their vaccines arriving, over 60,000 of them next Tuesday. They say by the next day they may well be ready to start administering them.